Hi everyone. Today's seminar is on lifestyle medicine and brain injury. Dr. Jared Brown is going to present, and I'm very much looking forward to what he's going to present. Before he presents, I wanted to share some important thoughts or some thoughts I had about lifestyle medicine and brain injury, and I'm just going to begin with that. Why don't we get started? Does that sound good, Jared?
You bet.
Cool.
Let's
All
do it.
right. So in this introduction, I'm going to share my thoughts about why lifestyle medicine, why I think this helps people with brain injury, and also what more can be done for people with brain injury. For anyone who doesn't know, I'm a TBI survivor. I had a severe brain injury. I've had a long recovery, and I think about brain injury all the time. So, lifestyle medicine is an evidence-based medical specialty that uses various therapeutic lifestyle interventions. And Dr. Brown is going to present much more detail about this. So, I'm not going to get into lifestyle medicine, but I know that brain injured people, in my experience, and many people I've met, they have problems that go misunderstood, unsupported, and people with brain injury tend to fall between the cracks or fall through the cracks of the traditional medical and clinical systems approaches that are out there. From my experience and observation of others, lifestyle medicine offers support and help for people with brain injury because of the needs that brain injured people have. So, lifestyle medicine serves as a more comprehensive net or a more general support structure that is better capable to help people with brain injury over the long term. And I think we're going to get into a lot of that in great detail. So, four of the tenets that I have observed with lifestyle medicine that are important and help everyone include sleep and rest, promoting exercise and promoting activity, proper diet and nutrition, and social support. So each of these factors are important for everyone, and in lifestyle medicine, they are focused on. For brain injury, however, these are far more extreme. These needs are far more extreme. So I didn't know how to display it, so I'm just explaining it. I think the same factors are absolutely essential for brain injury. So in the first little box, the idea of sleep and rest. For brain injury, fatigue needs are so overwhelming and they need to be managed and reduced through proper sleep and proper rest. And that really has to be emphasized for people with brain injury. Exercise and activity is essential and important for everyone, but for people with brain injury, it's really, really important for both stress reduction. I think there's a neurotrophic benefit over the long run that really comes from being active. And another example, diet and nutrition, these are essential for brain health and improvement over time. Lastly, social support. The isolation and lack of support that can happen for brain injury is extremely detrimental, and these factors need to be reduced as much as possible. So I arranged this in the four different boxes because each of these factors are important to combat and improve specific brain injury problems and promote neurological health over the long run. Also, for brain injury, if any of these factors are missing, if you're not getting proper sleep, if you're not eating well, if you're not active, if you're isolated, that is such a detriment. With brain injury, it's like you're in a hole anyway, and if these factors are adding, it makes the hole so much worse. It makes it almost impossible to improve. The other factor that I wanted to talk about that I think is important for brain injury. So, if anyone's seen any of the talks I've been putting out, I have this framework and I have these invisible problems with brain injury. And I've experienced this and observed this in, I'd say, every single brain injury person that I've spoken to. Five layers of invisible problems that I have observed and experienced with any brain injury person. There are the core problems. We're going to get into that in more detail. There's the fatigue, and that's kind of connected or on top of the core problems. Then there's the psychological, emotional trauma. Then there's the ability to gain any awareness of what your problems are to even begin to work on them. And lastly, dealing with the misunderstanding that comes from the world around us. So the core problems is what I want to focus on because core problems, I see them as the problems that are underneath the other problems. Core problems can be thought of as the injured capacity or the function that was, I don't hate to use the word normal, but in a nervous system that was functioning regularly. And then once that gets injured, that capacity gets truly diminished and injured in each person with a brain injury. And these problems remain for the long term. These problems are different for every brain injured person. I hear time and time again every brain injury is different, and that's true. But we still all have a brain injured part, a part that is, and oftentimes it's multiple parts, multiple capacities. But these things truly need the help and support in order to deal with and improve these core problems. And I was thinking of how to explain this. And the other project that I do in addition to this talk series is a podcast. It's called Experiencing My Brain. Really, it should be called Experiencing My Brain Injury. And the discussion is to try to get with each person to the details of their core problems, to the details of what they are experiencing, so that the outside world can understand them or understand these problems. The last two episodes I just put out with Zach, and he describes visual and auditory problems very specifically. And I have a quote here. I'm just going to read a quote from Zach, but the point is he describes very specifically his sensory issues, his visual and auditory processing issues. So Zach describes about 6 minutes and 11 seconds into the discussion. He's talking about trying to watch TV. The colors of the show were too bright. Like you could kind of feel almost like rings around the colors when I would look at it. And then kind of a combination of visual with the audio. Sort of felt like static, like a staticky radio station. And so it was like an instant reflexive need to turn it off, right? Because of the overwhelm. So Zach and I talked for about an hour, and he describes these sensory issues, and those are his core problems. Somebody experiencing problems like Zach, I think for whatever lifestyle medicine benefits are provided for him, he also needs help and some way to work on these specific problems. The interview I did just before that is with Michelle Kaufman, and she describes four core problems. And I have talked to Michelle about these things multiple times. So we got it in the interview. She describes she has these horrible pains in her neck and in her head because of the brain surgeries after her first TBI. And those pains are really a problem, and she's not getting the help she needs for that. Also, she describes her autonomic nervous system injury. That happened after her second TBI. She has drastic cognitive problems. And lastly, she has this inability to be aware, which is basically anosognosia of her problems. So she has developed ways to manage her life, especially with the cognitive problems when they're at their worst. And she isn't aware that they're at their worst, but she has other cues and other tricks she's used in order to even be aware of that. And just to read one quote, I at the start of each of these episodes, I begin with a statement or some words that the person had said to really exemplify a core brain injury problem. And Michelle said, I lost my whole autonomic system. And that means I don't blink, I don't swallow, I don't do anything your body does for you naturally. I have to remember to breathe. I have to remember to pee. I have to remember to swallow. That's the big one. That's how I found out about my autonomic brain injury is I was pocketing my food like a squirrel. I would shove it into each pocket as I took a bite of my cheek until they were exploded. And then my choices were throw it out into a napkin quietly at the table or go to the bathroom and spit it out. And I didn't realize what the problem was because I was brain injured. So the reason I point out these two individuals is that each of them has very specific brain injury problems that they really need help with. For every brain injured person that I've spoken to in my podcast, but also I'd say I've spoken to probably over 100 now, they describe their own specific brain injury problems, and I look at these as the core problems that that person needs help with. If you're interested, I just put out an episode about a month or two ago called 12 Examples of Brain Injury Problems, a compilation episode, and I just cut 12 different explanations that people have of what they are dealing with. Each one is different, but each one I see it as at the core of what they're dealing with their brain injury. So to sum it all up, to begin Dr. Jared Brown's talk, lifestyle medicine offers a multidimensional approach to help support people with brain injury in a generalized and holistic manner that has multiple benefits and really is beneficial. However, I think lifestyle medicine does not necessarily focus specifically on brain injury problems. And for each brain injured person, their core brain injury problems need to be first recognized, then treated and targeted, and found some ways to improve because that's what each brain injured person is dealing with. And so that's why I see lifestyle medicine as complementing or in combination with other treatments. So, okay, that's my thoughts. Jared, I'm going to change you to be the
Dan, I
presenter.
just sent you the request. While we're on that, you said
Yeah.
lifestyle medicine could complement other things. What happens if we have a paradigm shift and lifestyle medicine is the foundation, and then all these other interventions complement lifestyle medicine. That's what we're going to talk about today, folks. And we're going to cover a lot of ground. Let me just share my slide.